Minutes past 9 o'clock, and yes, it is a Wellness Wednesday. We try to get you whipped into shape there, Jackie.
All right.
Ready to go. And with us right now is, again, our wellness doctor. It is from our line right Chiropractic, Dr. April Oxendale. And we were just chatting off the air before we went on. For the last couple of days, these guys have had to put up with me doing this. Just trying to...
A little stiff.
A little stiff and just trying to crack myself. And you did something very unusual. I didn't expect this. But you reached over and within 5 seconds... She said, "Okay, you're what'd you call it?
I'm stuck.
I'm stuck. I'm stuck."
That's a technical term.
It is.
No, you just reach behind my neck. Go ahead and show what you did.
Right in through here.
Right in through, and that's where, right there is where it hurts, and where I feel like I need to get cracked. But you can unstick me.
I can.
All right. Where can I get unstuck?
82nd and Hickman.
82nd and Hickman. Okay.
Yeah,
Can't you just hit him with that metal thing and get it over with?
Like over the head, maybe.
All right, but that's not what we're here to talk about. That's not what we're here to talk about. But it was amazing. She diagnosed it that quick. But we're going to go check that out a little later on today. But we're here to talk about something that a lot of people are afflicted with, and that is something sports related.
Yes.
Supposedly
Yes.
sports related.
So today we're talking about tennis elbow and golfer's elbow, which is not just for golfers and tennis players anymore. Golfer's elbow is more on the inside of the elbow, so in through here. And tennis elbow is on the outside of the elbow. So golfer's elbow.
I've had
and
that.
Tennis elbow.
That's very painful.
And tennis elbow is because it's an irritation of the wrist extensors. So if you flex your wrist up and you feel it, the muscles contracting through here. So it's a repetitive motion injury. So people that are turning wrenches all day long,
mechanics,
hairstylists that are working with shears and blow dryers and brushes all day long. Then golfer's elbow is more with the wrist flexors on this side. So it really, it does affect still the golfers and the tennis players and different athletes. Lots of times pitchers, because they're throwing the ball and they're doing all kinds of rotation. But
a lot of times you'll see those guys wearing that band right
here. Yes.
Oh, that thing works wonders.
It does. It takes the pressure off of the tendons there, so it releases through the muscle tissue itself. But if we can go in and correct the problem, like I said, it's a muscle overuse issue. It's a chronic repetitive motion injury.
There's a golfer.
Yes, the golfer, you can see how it's a lot of pressure in through that elbow.
So these are tendons?
They are tendons. So the wrist flexors and the flexors and there you go. There's the picture up there. They insert there on the elbow itself.
Okay.
The medial epicondyle and the lateral epicondyle. So it's just a part of the bone that the tendons insert on.
Okay, when they're attached to the bone right there.
Right, they're attached to the bone there. When that muscle then gets tight, it pinches down kind of like a rubber band. It just restricts here. Then the tension comes out here to the tendon.
Okay.
So you can see how when the muscle belly contracts.
So the pain is coming where that circle is in?
Right. That's lots of times that is a point of pain where that big circle is. But when that muscle belly contracts, the tension comes off on the tendon, and so that's where you're going to feel the pain. But the problem is actually in the muscle belly itself. So it's just the scar tissue buildup, like we talked about with Graston a while back.
Okay.
So we would go in. This is one of my favorite tools to use.
Oh, it's so scary.
With golfers and tennis elbow, and you just run it along the muscle, and you break up the adhesions inside that muscle, and you restore function. So you'll restore your grip strength. You'll get rid of the numbness and tingling. You won't have the pain anymore. You'll be able to sleep at night. I have a patient right now that she came in, and she is a hairdresser, and she noticed when she changed dryers, the dryer she uses now is a little bit heavier, and she can't hold on to it very well. We've worked with her a couple of sessions, and she's got her grip strength back. It's phenomenal the changes that you see with it. When a patient comes in, another patient works at a desk job all day long, and so she's on the keyboard all day long. It was keeping her up at night. Couple of treatments and she sleeps through the night.
Now is that usually the run of it? A couple of treatments, you'll notice a difference?
You'll notice a difference within a couple of treatments. I like patients to give me 6, just so we get the condition under control, and then you can go for tune-ups afterwards.
So a lot of times this tendonitis, you think of pain and you think, all right, I'll throw some ibuprofen, and it doesn't seem to help a whole lot with that.
So the ibuprofen is going to help a little bit with the inflammation, but it's not actually fixing what's causing the tendonitis. So it'll help with the pain, but you need to fix the problem, which is the muscles.
What if you don't? Are you looking at permanent damage to that area?
You can. Lots of people end up getting cortisone shots, and eventually they quit working, and so then they look at doing surgery where they'll go in and they'll just snip the tendon off.
Ooh.
Yeah. So if you can prevent the cortisone shots or the surgery.
Yeah, you don't need
Why
to be
wouldn't
doing
you?
that.
Right.
Yeah.
Right.
This reminds me when we were working out on the show that we had the big rollers that we would use to kind
Yeah,
of
foam
help
rollers,
the
sure.
foam rollers, and it's almost like a smaller version of that.
It is, and it's a similar principle. I love my foam roller. It's kind of a love-hate relationship.
Right.
Yeah, you hate it when you're using it, but love
you
it
do,
afterwards.
but
Yeah.
absolutely. So, but like I said, it affects everybody. Tattoo artists, because they're holding a gun all day long. The mechanics, plumbers, construction workers, with all the vibration from their tools. I mean, it's just everybody can be affected
So
by
people
it.
are experiencing a problem like this. There is something that can be done, and it's not surgery.
Correct. And lots of times people will come in and they'll say, I've got carpal tunnel-like symptoms. So of course you're going to check the wrist out because that's where the carpal tunnel is. But a lot of the carpal tunnel-like symptoms are coming from the
That
wrist
area.
flexors and the
Wow.
extensors.
Really?
And I don't know if we've touched on insurance before, but in a lot of cases, the visit to your office is covered, correct?
Correct. Insurance does cover for most of it.
And you guys
depending
will
on
check
the
that out
plans.
ahead of time?
Yep, absolutely.
Okay. Let me give you my card.
Okay.
Find out
So you
here.
can get unstuck.
United Healthcare, you take that?
I do. I do.
You gotta get
All right,
unstuck.
so- all right, well, tell everybody again where your office is located.
82nd and Hickman in Clive.
Oh, wait.
It's just right on the corner there. You can visit my website at myalignright.com or give me a call at 278-4676.
What are you doing, Parkin?
I just want to wave at the end of the segment.
Or Ollie's arm.
Is Ollie okay now? Is
He is. He was okay donating his arm for
okay.
today.
Let's see. He'll
As
get
long
it
as
back.
he gets
though.
it back.
You're gonna lend him a
Yeah.
hand when we get back.
I am.
Okay.
Yeah.
Okay. He had to
He
lend a
lent
hand.
me
you-
a hand this morning, so.
Perfect. All right, folks. It's 19 minutes past 9 o'clock.